Computer. Welcome, everybody, to our chat for World COPD Day. One of the chats we're going to have today is about sputum clearance, and we have Hallye Ward with us from Trudell Medical. She's going to share her expertise with us. We'll start with a presentation about the device, and then the keep breathers will come on and we'll have conversation, share our experiences with the device, and ask some questions. Hallye, welcome. Thank you so much for doing this for us tonight. Do you want to just introduce yourself and maybe tell us your connection with Trudell, what you do there, and then we'll get going.
Yes, thank you guys so much for having me tonight. I'm excited to talk to you about the Aerobika device and mucus clearance. So as Lisa mentioned, I am with Trudell Healthcare Solutions as a medical device representative. I cover the AeroChamber device and the Aerobika device all across Ontario from Scarborough to Ottawa. So I'm happy to be joining you tonight. Hopefully we can have some good discussion about the device and answer any questions you might have. And if we're ready to start, I will begin the presentation.
We're looking forward to it.
Okay. So let me know if you can see the presentation. And I'm just going to, okay, perfect. So Aerobika OPEP device, what is it? I'm going to start by explaining a little bit about what OPEP means when I say that. I'm sure there's a couple questions on what the term is. So OPEP is oscillating positive expiratory pressure. And what that means is that when you use this device, it's a drug-free device that creates a resistance in your lungs and in your airways through positive expiratory pressure. And then the oscillation part of the device creates vibrations within the airways to mobilize your mucus up and out of the airways to clear it. So here's just a little diagram showing what happens when you use the device. So without Aerobika, you might have some mucus within your airways, that makes it hard to breathe. And then when you use the Aerobika, again, it's opening up your airways and then vibrating them or rattling them so that the mucus can be moved up and out. So I'm going to show you how the device works. It's really simple to use, and as I mentioned, it's drug-free, so you don't have to worry about any medication being involved. This is the device here, and what you're going to do is you're going to close your mouth around the device, and you're simply just going to breathe. So I'm going to do that now, and then I'll explain some more. So as you can see, I'm just breathing in and out of the device, and after about 5 to 6 breaths, what's going to happen is you're going to feel that mucus starting to come up. And at that time, you're going to perform a huff cough, sort of like a cough that you would fog up a window. And that's going to bring the mucus out of your mouth, and you'd cough or spit it up into a tissue or somewhere else, not into the device though. So the device is just moving that mucus up and out, and then you're going to cough or spit the mucus out. And when you're using the device, you're actually going to feel vibrations on your back and in your chest. And it's kind of like a nice massage for your lungs. There's a couple things I want to note about the device and when to use it and how to use it. So there is a resistance on the device. So down here you can see the resistance. It has an option from 1 to 5. When you purchase the device and you get it out of the box, it's going to become preset at 3. And it's usually recommended that you start there with the resistance, but working with healthcare providers like Lisa or your doctor, you can find what's best for you. Or you can also get a sense on what resistance you should be using based on how it sounds when you're using it. So I'm going to try and play these sounds now, and hopefully you can hear them. Lisa, let me. So this is what you want it to sound like. Just a slow flutter of the valve inside. What you don't want it to sound like is these two sounds that I'm going to play next. So the first one is going to be that you're breathing too slow into the device. And so this is what it would sound like. this could also be an indication that the resistance is too high. So if you're having a difficult time breathing into the device and you can't get it to make that nice fluttering sound that we first heard, you might want to lower the resistance. And then this is if the resistance is too low. So maybe you need to put it up closer to 5, or you're breathing too fast. So this is what it would sound like.
Oh,
So you can hear it's fluttering very quickly, and you can clearly tell that it's too fast.
so can you play the right one now again, just so now that we've heard the two wrong ones?
For sure.
Sounds like a sewing machine.
It does. And as you can see here, it says that higher does not mean better necessarily. So having a resistance of 5 doesn't indicate that you have the strongest lungs of the group, or that you're doing anything better than the next person using the device. It's really just based on how you're feeling that day, how your lungs are feeling that day, and what your needs are for clearing mucus out of your own airways. So if you stay at 3 the whole time you're using the device, then that's great. Then you can leave it there. So now we'll talk more about how the device comes apart and what you can expect when you get the device. So as I mentioned, this is the device here, and it's going to come apart into 4 pieces. So you're going to squeeze the sides, and it's going to come apart to the top and to the bottom. The bottom includes this piece here, and then this piece, which is what's creating the fluttering noise when you breathe into the device. And then the top piece is going to be the top and the mouthpiece. And so everything you can then put into the dishwasher or warm soapy water to clean. And then you can put it back together really easily because it only goes back together one way. So here's the bottom piece, and I'll show you that it doesn't fit when you put it together like this. You have to flip it around and it will fit in nicely. And then same with the top piece. You won't be able to fit it down like this. You'll have to flip it around and put it in like that. And then the mouthpiece, it won't fit on the one side. It will only fit on the side that it's supposed to be in. So once it's apart, you might have to play with it a little bit to get it back together, but you won't put it back together wrong. Something else to mention about the device is that you can hold it in many different ways. So if it's more comfortable to hold it to the side, you can actually flip the mouthpiece around and hold it to the side like this and breathe into it. You can even hold it upside down if that's more comfortable for you. It's really whatever feels best. But typically holding it like this is usually what people do. I mentioned washing the device. So once you take it apart into the 4 pieces, you can put it in the dishwasher or warm soapy water, and then you're just going to air dry it overnight. And it's recommended that you do wash it daily if you're using it every single day. But I'll leave that up to your discretion. I know time gets away from us, but it is safe to wash it every single day if you're able to remember to do so. I will also say that if you are having an infection, or if you're at risk for lung infections, then it is important to wash the device, just because you are breathing into it and you wouldn't want to risk the chance of having bacteria staying in the device and then it going into your airways. How often should you replace the device? It is recommended based on our clinical evidence that every year you should be getting a new Aerobika. Most private coverage will cover it once a year. So if private coverage is available to you, every single year you can get another one, and you should be eligible through your insurance plan. Or you can just purchase a new one at the pharmacy or buy through Lisa. She also has access to them as well. I just wanted to also make note of how you can use it in combination with a nebulizer. So if you do have nebulized treatments that you're on, you can kill 2 birds with 1 stone by actually attaching your nebulizer to the back here. And when you breathe in, you'll be getting that medication. And then when you exhale, you'll be getting your benefits of the OPEP therapy. So that's something to also keep in mind if you have that as part of your treatment regimen. I also wanted to mention what it's doing clinically to your lungs. So while you might also feel the mucus coming up and feeling better in that regard, it's also doing some other things for you that you might not notice right away. So your lung ventilation and how much air is within your lungs is actually going to improve over time with using the Aerobika device. Your quality of life can also improve because, as you can imagine, not having mucus and coughing that up all the time will lead to a better quality of life. And it will also reduce exacerbations. So we've actually been able to study and find that using the Aerobika device can reduce exacerbations, which also reduces your chance of going into the hospital and being admitted there. And this is just a nice diagram here to show what the Aerobika is doing in your lungs and how those outcomes are achieved. So I will get my laser pointer here, and you can see that before, this is a pair of lungs before using the Aerobika device. And the teal here is showing air within the lungs. And you can see here that there's this lack of air, or these dark spaces, and that's due to the mucus plugs not allowing for the air to distribute within your lungs. So after using the Aerobika, what happens is that mucus is cleared and it's thinned, and then air is able to distribute fully within your lungs. And so that's how your lung function and ventilation is improved, and that's how your exacerbations are reduced. And then lastly, also how your quality of life has also been impacted as well. The last thing I want to mention is that OPEP is a form of chest physio. So it fits really nicely into Lisa's realm of work because as being a physiotherapist, I'm sure she's taught you lots of techniques for how to do either airway breathing techniques or percussions on your chest. And so this is a nice device that you can use at home when you don't have Lisa there with you to provide a form of chest physiotherapy. So that's it for me on the device. And so I'll stop sharing my screen and then we can do our Q&A.
Okay, excellent. That was excellent. So you guys can go ahead and unmute yourselves. So I will go through, ask you to unmute.
I have a question, Haley.
Okay, Carol, I'd love to answer or try to answer.
Should you be using this every single day, whether you feel you need it or not?
That is a great question.
Because
So
I don't.
that's okay. I think it's like most things in life that when we don't notice something, we forget to take preventative measure. So ideally, you want to be using the device 10 minutes twice a day just to maintain your mucus, to make sure
10 minutes twice a day.
Sorry?
10 minutes twice a day.
Correct. So that would be the gold standard practice of care, our ideal treatment. But to your point, if you're not feeling your mucus is bad, the device isn't going to bring any mucus up on those days that you don't feel you have thick mucus. And so you're just going to be using the device to strengthen your airways. When your mucus is bad, then that's when you're going to see the benefit. So you're not harming yourself by not using the device every day, but you're definitely benefiting yourself if you do, just because it does have that impact on strengthening the lungs.
Yeah.
I'll say that the Aerobika is named the Aerobika because it's aerobics for the lungs. So you can look at it as doing exercise for yourself every single day.
Yeah. Yeah. Part of the trick is to create the routine, right? So, having that sort of time set aside at the same time or relatively the same time every day. So it becomes part of your routine, whether it's coordinated with your medication or some other part of your day. Try and do it when you've got energy to do it.
Absolutely. And something that I
Sorry, I just thought that you used it when you had a mucus. So it's beneficial to do it whether you got mucus or not. Is that what you're saying?
Correct. So, I was going to say that if you're including it into your routine, it's really important. And something I suggest for patients is if you're watching TV, it's a great time to bring it out on those commercial breaks and do it then. And then if you don't have mucus, Rhonda, then you're strengthening your airways at that time.
Okay.
If you do have mucus, then you're also clearing your mucus as well.
Okay. Yeah, because I don't have, like, I very seldom ever have mucus, but I was never told that I should still use that. So I just figured so now I'm going to start using it a couple times a day. If it's going to strengthen my lungs, I'm going to do it. Thank you for that information.
No problem. And you won't find the same benefit because it is a mucus clearance device, you won't find that your mucus is going to be cleared because you simply don't have mucus, but you aren't harming yourself by using it.
Okay.
If you have it,
Yeah.
I would do it.
So if you are mucousy because you've got a chest infection, can you do it more than twice a day?
You can
What's
do
the
more than
recommended?
twice a day, and the respirologist recommendation is if you are really mucousy, if we're going to use that as a word, I like that.
Yep.
Then sometimes they'll even encourage 3 times a day.
Yeah. Yeah. Just to help clear. Just to
Yeah.
help clear. Yeah. How many people in the group have one?
I do.
Yeah, I know.
I do.
I don't have any.
Aerobika, but
There's mine.
Len's got his right there with him. Amazing.
I'm practicing.
I have
Let's
a
hear it
question.
make the sound.
I have a question.
Okay,
Hi,
go ahead.
Patricia.
My question is, I'm not sure what these different terminologies are for lung disease, but mine is called interstitial lung disease. Is that different than COPD? And would the treatment be the same? Like my respirologist has never told me I should have such a thing as that, and I'm just wondering.
So are you referring to ILD, interstitial lung
I
disease?
think so.
Yes.
Okay.
Yeah.
So if it wasn't a conversation with your respirologist, that might have been because you haven't mentioned that you have mucus. And so typically the aerobica wouldn't be initiated if mucus was a symptom that you were experiencing.
I've never had a lot, but I do have it. But I wouldn't say I have a lot or every day, but I do have it.
So the
And it's,
aerobica could be beneficial to you. It's
yeah,
not tied to a specific disease like COPD or bronchiectasis. It's simply just tied to mucus clearance. So if you
okay.
have ILD and you have mucus that you could clear, then you would benefit from the device.
Maybe I should ask him at my next visit then. Should I?
Yeah.
I
Sure.
think
Yeah.
it's worth a conversation for sure.
Yeah.
Okay.
Yeah. Just remember, anytime you have mucus that's retained in your lungs, that puts you at more risk of infection. So we want to make sure that we're, however way we can, is to keep those airways as clear as we can.
Get rid of it.
Right.
Exactly.
Thank you.
Exactly.
I have a question.
Yeah. Go ahead, Sue.
I'm just wondering if the timing of when you use it is important. Like, should you use it just after using one of your bronchodilators or
Good question.
any other time?
Really, that is a good question.
Yep.
So this is what I call the chicken and the egg question.
Yeah.
Chicken
Yeah.
or the egg.
Figures.
Yeah.
I have discussions about this with Lisa and respirologists and different RTs. It's really dependent on the patient. So if you find that you don't have the lung capacity to breathe into the device because you haven't used your bronchodilator yet, I would suggest using those medications first. But if you can't get out of bed because your mucus is so bad and the first thing you need to do is clear your mucus, then I would use the aerobica first. There's debate on whether or not clearing the mucus will allow the medication to penetrate better into your lungs.
Yeah.
Or if it's easier to use the device once you use your medication. So
Yeah,
I don't think there's a right answer. I think it's
From my
Thank you.
experience,
Okay.
That makes sense.
from my experience, people either works one way or the other, and it's trying both. So certainly people that, like Hallye said, that have lots of mucus, doing the aerobica first to clear the airways, then creates a pathway for the medication to go down.
Right. Okay.
And then other people, if you take your medication first, if your secretions are really like kind of deep and quite sticky and retained, taking your medication first opens up your airways, so then you might be able to get that out a little bit better. So
Well,
It's
even
kind
using
of
the rescue inhaler, Lisa, wouldn't that be one to say? Use a rescue inhaler,
True.
and then after you do that,
right, and you could
you
do
can,
that.
and then
There's
take your
even
medication.
Yeah, you could do that, but even with the rescue inhaler, some people take that as one of their regular
Oh, okay.
inhaled medications. So, yeah, if you're really mucousy and you can't get even that down, then sometimes doing the sputum clearance first um, is the right way, but there is no one right way. It depends on what's right for you. Yeah.
I'm going to need a bigger bedside table.
Yeah. Bigger drawer for the pills. Yeah.
Let's go down and get a freezer basket.
Yeah,
Yeah. Yeah.
And I can continue to use mine just to strengthen the new lungs.
The new one.
yes, right.
Yeah.
Yes, you can.
Yes,
I'm
right.
sure you'll use your Aerobika very well now, Donna, with your.
Yes.
It'll be a whole different experience.
Yes.
Yes, I had my first breathing test yesterday in Toronto since I had one. And the guy says, "Well, that's a remarkable difference since the last."
Yeah.
Gee, I wonder what's changed. I wonder what's changed.
So.
Linda, I saw you had your hand up. Do you have a question?
I do not have COPD, but I've had a problem with raspy throat and phlegm for years, and nobody can figure out anything to do for it. Would this be appropriate for me?
Absolutely. So, as I mentioned before, you don't need a diagnosis of COPD or any lung disease to use the Aerobika. It's just that mucus clearance or that excess mucus as a symptom that would indicate that you would be a good candidate for the device.
Okay, thank you.
Yeah. They're starting to like post-COVID people, they are using it to help with building up their
Breathing.
their breathing capacity.
Another place we see Aerobika being used is post-surgery. So sometimes
Post-surgery,
there's
yes.
the risk of post-surgical,
Yeah.
post-operative pulmonary complications.
Yeah.
And so using it then has also been beneficial.
Rather than using the incentive spirometer.
Yes, exactly.
Yeah. Yeah. I could see how that would be a difference. I guess the cost is a bit different, but
Yeah, and it's making sure that
however, if it produces the right result,
can't put a cost on that.
well, and if you end up having a post-surgical complication, right, it's way more expensive than what an Aerobika would cost.
Yes.
Absolutely. And
Yeah.
and even the risk of having, say, pneumonia after surgery, reducing the risk of that using Aerobika would be beneficial.
Yeah. Yeah.
Absolutely. Is there any other questions? These have all been great.
Well, I'm glad to know that you say it strengthens the lungs, even if you don't produce mucus. It's effective for strengthening your lungs.
It'll help create open up your airways a little bit more.
Okay. Yeah.
It's recruiting those diaphragm muscles, so that's where that part is coming from.
Yeah.
But really the indication is to clear mucus, so that's why I want to make sure that I'm clear on that. That it's not just that's not its key indication is to not strengthen the airways, it's to clear the mucus.
Yeah, the primary reason people would be using it would be that mucus clearance for sure. Yeah.
Do you have any other gadgets?
I do have the.
We want to know all the jobs. Anything
Do you have the attachment with you for the nebulizer?
I don't have that with me.
Okay.
That is. I just had a meeting today about that actually, so it's something that I should carry with me because it would be really helpful.
Yeah.
Maybe tell them just briefly what a nebulized treatment is because maybe they don't know.
Okay.
They're good.
And maybe I can share my screen again just to show you a diagram.
Yeah.
Of what that looks like. So I'll go back here. Okay. So sometimes I'll use an example with bronchiectasis, which is a lung disease. that people are prescribed hypertonic saline for. And in this condition, this hypertonic saline is usually administered through a nebulizer, which is this piece here. And so the medication, this is attached to a compressor where the medication is put in. And then it's going to come through the nebulizer here. And what happens is this is going to aerosolize the medication so that the patient using it can receive that medication through an aerosolized substance rather than a powder or a liquid or a pill. So it's like
It's like a mist. Yeah, it's like a mist. Yeah.
And so when you use the device, you're breathing in the medication from here. The medication's going to come out in that mist. And this one here, this is our Aero Eclipse nebulizer. It only distributes or administers the medication upon inhalation. So it's not constantly releasing from the nebulizer until you inhale. So once you inhale, that medication's coming through. You're going to receive that medication, and then you're going to exhale. And what's going to happen is your air or your exhalation breath is going to be redirected. So you're just going to breathe out, and that's going to go into the aerobica here, and it's going to create that positive back pressure and that oscillations, and then you're going to repeat the cycle.
So do you ever just use it with just saline, just if somebody's got really like sticky secretions? Like we used to do that years ago, do just a saline nebulizer for somebody who had really sticky mucus and they couldn't cough it up because it was so sticky.
Yeah. So that is a great example for when that would be used.
Okay, so you can use it without actually medication, just with the saline.
Correct.
Okay, because
Awesome.
I have the machine, the nebulizer machine,
Yep.
and you hook up and put the fluid into it.
Yep.
Now, but is this a different attachment? Because the other one goes to my face. Now, how does this? Where do you get? Is this attachment? This part, that's the part that's got the liquid in it. Is that a separate attachment you have to purchase?
To the compressor part you're talking about. That's what
Yeah.
this tube would be leading to.
To the compressor. Yeah.
Okay, I have a compressor.
Yeah.
And you put the hose into it and drop the fluid, the liquid into it, and then you put it on your face and breathe it in.
Yeah. So you would breathe it in through the mouthpiece.
Right. Yeah.
Okay. So that's on my machine then. That piece that has the liquid in it, and I just hook it up into there.
So that mouthpiece part that you're putting on, that would be replaced by this now.
Yeah.
Okay.
Yeah, the Aerobika.
It's been a while since I've had to use it, but a couple years ago, I was constantly on that nebulizer because I was in bad shape. But I mean, I've improved. Oh, believe me, I have improved. I've been put on hold for 6 months for lung transplant because I'm doing so well. Yeah,
I'm so happy to hear that.
To Toronto and everything, but.
Well, I'm happy to hear that you're doing better, and I hope you don't need to use your nebulizer as often as you once did, but this is an option if...
Yeah, that's a good idea.
And it's kind of nice because it's combining two things at once, right?
Yeah.
Yep, combination therapy.
Yeah.
Yeah. Yeah.
I see a hand up here. Anne?
Hi. I use a nebulizer every day because I have bronchitis and severe asthma. Now I do this part here at the bottom is hooked up to my compressor, but I never thought, and then I breathe it in through a mouthpiece. I never thought about using it this way. I do two types of, one is the cholestyramine. It's an antibiotic. I mix with this with the when it's not in front of me, I can't think of the name. But anyway, and then I also use it with the sterile that we were talking about earlier. Some nebules, and I put it into this thing. So I use it.
Do you want to just stop your screen share just so we can see?
Yes.
Sorry. There.
So, you know what I'm talking about, right, Haley? But you your thing is hooked up to a compressor as well, right?
Yes.
Yeah, and then if I were to use this system, I would be breathing in through the Aerobika and alternating it with the nebulizer, or how does that work?
So it just becomes one whole unit. So this would be
Yeah.
your mouthpiece now to your
Right.
nebulizer.
Okay.
And your nebulizer would be attached on the back here. So then you're
Okay.
just simply breathing in and out as you
Oh, okay.
normally
Just
would.
normal breathing.
Yep,
What I'm used to, but just going through another channel.
exactly. You're
Yeah.
just adding one more piece in the middle there.
Okay. Okay. I don't have the Aerobica. I have an old thing that I got when I was at St. Mike's Hospital years ago, and
Okay.
I'm still using it. It's my Huff and Puff thingamabob. Um,
Might need to be
okay.
replaced if it's that old.
Yes. 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 It
Yeah.
probably
So,
does.
so what are some of the reasons
Where would I?
what are some of the reasons why you would replace it? Like, why did they say a year?
That's a great question. So we're going
Yeah.
to get a little bit scientific here.
Okay.
The reason is so the oscillations that occur from the device, they're
Mm-hmm.
being created at a waveform that mimics something within our airways called cilia. So our cilia naturally exist within our airways to kind of sweep debris and mucus out of our airways, and they beat at a frequency that's optimal for that function to occur.
So
With
those are the
the
little hairs, right? The little hairs in your airways.
Yes,
Hair-like.
yes, the
Yeah.
cilia are the hairs that
Yeah.
line our airways and
Yeah.
um,
Yeah.
kind of in our nose here as
Yeah.
well.
Yeah.
So what the aerobica, what we've been able to do is we can mimic or kind of replicate that frequency or that beating motion with the oscillations. And so over
Cool.
time, the valve that's creating those oscillations at that same waveform, it can degrade like everything does over time. And so we just can't guarantee that over a year, that waveform or that oscillatory frequency is going to maintain just because we studied a year period. And so we were only able to guarantee that that's maintained for a year. And then past that, we didn't look at if it was being maintained. And so that's why we just say a year.
Yeah. Yeah. And you want to make sure that like all of the component parts are in good working order, um, making sure that you are cleaning it because you don't want it to be harboring any bugs, right?
Mm-hmm.
Yeah.
So that's another great reason to replace it as well. Even with
Yeah.
proper cleaning or consistent cleaning, it's time to replace things after some point of time. So,
Yeah.
and I don't
Especially
know,
because you're breathing through it, right?
yeah.
Yeah.
Um,
Same with your aero chambers, right?
Same with
Right.
the aero chamber. Every year, if
Yeah.
you can replace those, that would be ideal.
Yeah. Yeah.
I have a
Go ahead.
question.
Yeah. Ahead, Anne.
If if I go to my pharmacy and ask them, oops,
Go ahead.
what did I do to you? Um,
We can see you and hear you.
yeah, and I just did something so that you're all so small. Here we are. If I go to my pharmacy and ask them to order an Aerobica, can they do that, or do I have to go to a special
You,
outlet? Or?
you, we actually at Evolve, we're very, very lucky that we get a really nice discount to
Oh, lovely.
provide for our people. So
Okay.
I don't have any in stock right now, which I'm going to talk to Hallye about. And
Take that
we'll get
offline.
some. Yeah, we'll get some and have them available
Okay.
for sure. Yeah, I know
Okay.
I have a couple of people that have asked, so
Same with your
we'll get
aero
them.
chambers. If you need aero chambers from Lisa, she can get those for you as well.
Do you have
Oh,
your
yeah.
handy dandy the arrow to go close by?
If you give me 2 seconds, I can go get it.
Okay.
Okay, I will be right back, everyone.
Okay.
Okay.
So she's going to show us the
Oh, terrific.
Aero to go, which is the sort of pocket aero chamber.
Oh,
That
that's the one that we
yeah,
got. Right, right. Oh, I need
yeah,
another
Pocket
one.
aero chamber.
yeah.
Yeah.
So it's a way of you can put your rescue inhaler right inside of it. It closes it all up, and you can take it with you rather than taking the big aero chamber
Yeah.
and your device
Yeah.
separately. It keeps them together. So when you throw it in the bottom of your bag, you're not rummaging for
Yeah,
for the
Right.
pieces.
Oh.
Yeah, so it's a really
Nice.
nice newer option for the aero chamber.
It's
Yeah.
so handy.
I
It's
kind
so
of had Lisa
handy.
introducing it, so she hit the nail right on the head. So this is our original aero chamber that you guys
Right.
all probably have seen or hopefully own one if you're
Yeah, I use
using
them.
these kinds of inhalers.
Mm-hmm.
Yeah.
So what we've done is we've created a new aero chamber that looks like this.
Oh.
And what's different about it is that you can open it up and the MDI actually sits inside.
Mm-hmm.
So it's
Mhm.
carrying it.
Yeah.
Yeah.
And then it just goes in the back here, like that. And then it works just like your regular aero chamber. So this is now your,
Nice, eh?
Yes, lovely. Yeah.
Mm-hmm.
Yeah.
Mhm.
So it's
this
really
is a great
nice
option for at home. And then this one's
Yes.
great for
for
traveling. on-
travel. Yeah. Yeah. Yeah.
Great.
Putting it in
Fits
your
into the
bag.
handbag.
Yes, in your handbag, or even if you're
Mhm.
traveling in your carry-on or whatever.
Or even a man
Yeah.
to carry it in their pocket. That's how compact it is.
Yeah.
Mhm.
Yeah.
Exactly.
Yeah.
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 And if any of you have grandchildren that use inhalers as well, it's even great for backpacks and things like that. So
Yeah, for
for
school.
all of you,
Yeah.
but yeah, exactly for school.
Yeah. Yeah, there's lots of kids with asthma that need inhalers, and that's a really good option because it's everything closes, right? So it doesn't get dirty.
All together. Yeah.
This is
Yeah.
staying nice and clean,
Yeah.
and then you also have your aero chamber at all times. So yeah, that's the
Yeah.
new aero chamber to go as well.
Yeah.
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 And so for everyone else that doesn't have Lisa's amazing group or program,
Yeah.
all the devices, they are available at the pharmacy.
Yeah.
But because you are connected with Lisa, then you can just simply ask her for any of the 3 devices we discussed tonight.
I'd like one of each, Lisa.
We'll take one of each.
Take one of each. Take one of each. Okay. All right. Do you have any further questions? This has been so great, Hallye. We really appreciate your time and your expertise for sure.
Well, I really
Anybody have any other questions?
No, I think she's covered everything.
Yeah, Hallie's a rock star.
She is.
All good.
And
Yes.
if you do come up with something tonight, if you log off and you think that you have another question, Lisa, always send it to Lisa and we can get the answer to you guys somehow.
Yeah,
I'm always
absolutely.
available.
Absolutely.
Great.
And enjoy people that might be watching this that aren't from the Keep Breathing program. Thanks for joining us.
Yes.
We love celebrating World COPD Day, getting the word out there that there are many things that we can do to self-manage and to live even a little bit better with COPD.
Absolutely. And I just
Thank
want to say a
you.
big thanks to all the providers like Lisa, who support patients with COPD, but then also to recognize all the hard work that all of you put in every single day
Absolutely.
to self-manage your
Absolutely.
condition and support
Yeah,
one another.
putting in the work.
Thank you.
Yeah. And this is a fantastic community. So seeing all
All
the
good.
support is amazing for one another.
Thank you.
Thank you, Haley.
Thank you.
Thank you,
Thanks,
Haley.
Thank you guys.
Okay.
It's so nice to see you all
Thanks,
again.
Haley.
Okay.
Thanks,
Thanks,
Lisa.
Hallie. Nice to see you.
Bye, Haley.
Bye, Donna.
Bye,
It was great
everyone.
to see you. Bye, everyone.